My name's Georgia Bowers. I'm a nurse and associate working at Landameads Nursing Home. I've worked at Landameads for nearly 4 years now. I was a support worker before I started the TNA course. I began my training to be a nurse and associate 2 years ago, following working through COVID-19. The NA role attracted me primarily through seeing other people do it when I worked through the COVID-19 pandemic and seeing the roles and responsibilities that they had. I work in a house that supports elderly living with advanced dementia, so they're in the very later stages of their life and they need full support with all of their activities. My job role is quite varied, so some days I'm supporting people with simple tasks such as personal care, helping them to eat. Other days I'm supporting the nursing team with giving out medication, liaising with GPs or other health professionals, and taking care of things such as dressings. I'd like to remain as an NA for at least a year, if not a little bit longer, gain my experience working within this setting, and then the hope is to go on and do the top up to be a registered nurse and again continue working with advanced dementia. If someone was to ask me whether I thought it would be a good idea for them to do the NA role, I would 100% advise it to them. I think that the fact that you can work whilst you learn is a great benefit, so you're continuously learning and continuously advancing new skills and gaining new areas of interest.
My name is Ros Heath and I'm the Register Manager at Landameads Nursing Home in Nottingham. We took on nursing associates right from when the legacy cohort started. And my main point at that was that I believe that people that work here needed to have a career progression. When we first brought them in, it was harder. I think there was a bit of worry from the qualified nurses we had about whether they're going to replace them. And there was a lot of ignorance around what the role would be, so there was an awful lot of insecurity to start with. As the years have gone on, that's disappeared. There's a nursing shortage nationally, both in the NHS and in social care. We don't use agency nurses at all. Just simply because we grow our own. We have people that actually are able to bring their knowledge, take it into nursing associates and then actually form part of our nursing team. So it's a more robust, caring, sort of effective nursing team, I think, as a result of that. Nurses are able to have the time to actually commit to other things that they can do in terms of care planning, in terms of the planning the structure of care that we do. I would just advocate anybody in social care to look at it and know the commitment to it initially financially is quite significant, but the long-term benefits completely outweigh that.